Hello and welcome to a brand new show of India Reboot, the show on which we would debate, deliberate, ideate, and also discuss what can be done to bring India back on the growth track. Just when it appeared that we had recovered from the scars of the first wave, the second wave has hit us. The sheer magnitude of the second wave is much greater and higher than the first wave. So has that really derailed the economic recovery which we had enjoyed in the first half of this year and the second half of this year? Also in terms of priority, what should the current administration prioritize to ensure that the growth is back on the track? Now, to discuss all that and much more, it gives me great pleasure to bring on board Mr. Punit Renjen, CEO with Deloitte Global. Punit, fantastic to have you back on ET Now. Thank you for joining us. Just hoping that everything is fine at your end. Punit, what is your assessment of the second wave? How different it is from the first wave? And tell us more about the Sanjivini project. What was the real inspiration behind the Sanjivini project, which frankly has been a great success in the state of Haryana?
Well, Nikunj, thank you for having me. And it is good to be with you. COVID hit India like a tsunami, and the second wave has been heartbreaking. It's deeply personal for me. My mother and family live in India. My mother was impacted by COVID, as were many of my family members. And I have 50,000 professionals that call India home. And we are working with them to protect them and to support them as they've been impacted by COVID as well. And I think what has happened is initially everybody tried to address the immediate need, which was oxygen. And you've heard about the global multinationals coming together. And I think that was absolutely critical. But to address the crush on the hospitals and the health infrastructure and to stop the panic, it is really important to diagnose and get to where COVID can be taken care of, which is in the homes and in the villages. So what we have started with Sanjivini Pariyojna, working with the government of Haryana and working with the PHFI, which is the Public Health Foundation of India, the PGIMS, which is Postgraduate Institute of Medical Sciences in Rohtak, is to assess in Karnal that 90% of the patients can be treated through home care, just like my mother was. And we have designed an integrated system that is fit for purpose for India to try and address that issue. We've been working with speed over the last 3 weeks. And in a very collaborative way, we launched it on Monday. I think it is having an impact. And it really has 4 integrated, uniquely Indian steps that make, I believe, the program both innovative as well as very fit for purpose. The first is the standing up of a command and control center, so we can get an understanding as to what is happening in the district and what is happening to the 5,500 patients. That number, of course, is fluctuating on a daily basis that have been impacted by COVID. We've programmed the system, we've used technology that existed in the district, and we've got that up and running. The second is to stand up a virtual health network. We have deputized 200 MBBS students that with supervision look out for 35 to 40 patients twice a day. And they're focused on 3 or 4 parameters and making sure that they are being taken care of. We've also come up with 6,500 home health kits that Deloitte paid for that include things like an oximeter, a thermometer, basic medicine, etc., that have been distributed using the Asha and Anganwadi network, uniquely Indian, to the home sites. We have taken lab testing, made it mobile, so that when required, those lab tests can be done at home, uploaded to the command and control center. The third thing that we have done is tiered the hospital system, again, working with the state of Haryana, so that there isn't a crush on the main hospital in Karnal. And we have taken 240 oxygen concentrators in every zilla and parked 8 advanced life-saving ambulances in every zilla, so people are confident that if need be, they can be transported with speed to the main hospital. And then the last thing is we have an awareness and education campaign. All of this together in an integrated way, uniquely Indian, leveraging capabilities that exist in India, I believe allows us to address this second wave. We're going to now do a second pilot in Rohtak and then hopefully scale it statewide.
So why do you think, Punit, the healthcare sector in India is broken down?
There has been an underinvestment in healthcare and the health infrastructure all over Asia, including India, and in the Western world. And COVID-19 really brought that into great relief. One of the lessons learned out of this is that we will need to invest in health and infrastructure, particularly in rural India and in rural communities, not just in tier 1 and tier 2 cities. We have great talent in India. We have great institutions. Having worked with the PGIMS in Rohtak for the last 3 or 4 weeks, I'm very impressed. The All India Institute of Medical Sciences, a world-renowned institute, but it needs to be implemented into the rural communities, which is what Sanjivani tries to do, leveraging capabilities that already exist. And so I think we will need to make investments in health infrastructure, but we will need to do it in a uniquely Indian way. The other, I said this at the top in response to this question, underinvestment in health infrastructure needs to be rectified not only in India, but across the globe and across Asia.
Punit, if you look at the difference between the first wave and the second wave, in the first wave, the fear was high, number of cases were low. But in the second wave, casualties, number of cases, the sheer spread is very high and very large. This time the rural India has got hit. It's like saying Bharat has got hit. What is your assessment of the economy? And more importantly, what are the changes do you think will be really permanent?
As I said, this has been a variant-fueled tsunami that hit India. And it has actually hit across the globe. We had our issues in the United States a few months earlier. So everybody has been impacted. This is a global crisis. It's a global pandemic. Nikunj, on the longer term, I am very optimistic about India. I believe that this is India's century. And I'm not just saying that with a bias being an Indian American. I'm saying it because the underlying conditions exist in India, the talent pool, the demographic dividend, the aspiration of Indians to move into the middle class, the large consumer base. All of those conditions exist in India. And so for the longer term, I am absolutely convinced that this is India's century. However, for us to get onto that path again, we must address the COVID situation, not just in India, but all over the globe. The United States, the Western world, and Asia. We need to first address COVID, and then we can build back better post-COVID.
What is your assessment of the preparedness of the corporate sector? Do you think the corporate sector has learned a lot and has done belt tightening after the experience of first wave? And this time around, India Inc. is geared up to handle the impact of second wave? And also, how do you think the entire supply and the distribution challenge or the distribution issues which have surfaced up, they will be managed?
Well, there are learnings, and all of us have learned as we've navigated COVID over the last 14 months. As I said to you the last time we spoke, COVID is a disruptive event. And we've had to learn to work differently, to live differently, to conduct business differently. That has been fundamentally disrupted by COVID. I think we have performed, I mean, I can speak to Deloitte, we've performed very well given the circumstances. And I can say that most of the corporate world has performed well relative to the circumstances. What we also know is that COVID has reaffirmed a few things and given us an opportunity to reassess. The reaffirmation is the digitization of business. In the last 14 months, there has been more digitization, more change in the way business is conducted, enabled by technology, than has happened in the last 5 years. That has been reaffirmed by COVID. That is the first point. But COVID has also given us an opportunity to reassess. What I mean by that is reassess the way that we live as individuals, the way that we conduct business, the way that we operate as a society, particularly around some of the big challenge that humanity faces, like climate change, like inequality, like systemic racism. I think those are issues that we must address, and COVID gave us an opportunity to reassess that. My hope is that we come out of this with lessons learned, and we come out and build back better and address some of these issues that are plaguing and will plague humanity for the next number of decades. And if we don't address, for instance, climate change, we will rue this day.
Punit, one clear trend which I think is visible is that because of the pandemic, the big are only getting bigger and large companies are becoming mega companies. The challenge is that if you go down the ladder, the entire impact of the pandemic is felt very strongly, especially at the MSME sector and the SME sector. What is your assessment?
Well, I actually have a contrary argument to that, which is given digitization, there is an opportunity for entrepreneurs and for small companies to really innovate. You don't need core capabilities within your four walls to be able to innovate. In addition to digitization, ecosystems or the ability to collaborate to solve difficult problems has been come to prominence through COVID. I mean, even at the start of this interview, we talked about Sanjivani. That is an effort that involves certainly Deloitte, but it involves the state government. It's a public-private partnership. It also involves healthcare and the Public Health Foundation as well as PGIMS. And so I think that ecosystem approach to solve a vexing problem is the wave of the future, which works to the advantage of small enterprises as well as entrepreneurs.
When we spoke last, the world was very different. Now we have a new administration. The China One policy is finding some resonance, and everybody suddenly wants to reduce the dependence on China. So let's connect the dots here. In your assessment, how things have changed? In your assessment, what will be the impact of this big uptick which we've seen across the board in commodity prices, from steel to copper, from orange juice to lumber? Just about everything has gone through the roof in the last 3 to 6 months.
I think some of the moves of the new administration are very welcome. I applaud President Biden and the American administration rejoining the Paris Agreement and really starting to take a lead when it comes to climate. I applaud, and that is an example of also working collaboratively with other allies like India in the Quad to address issues that plague all of us. So that is a really welcome move. I think the American administration also has a perspective to build back better, to address, as I said, some of these issues that plague not only the United States, but that plague humanity at large. And I applaud that. I also applaud what the American administration has done to come to India's aid in its time of need, just like India did when the US was going through a difficult time with the pandemic back in the fall and winter. So I think that sort of bilateral cooperation, bilateral friendship is really quite welcome. In terms of commodity prices, certainly inflation is something that we need to be watchful of. And I think the public policy makers as well as central banks are certainly going to do the right things. But if we do have inflation because of rise in commodity prices, I think that will negatively impact overall business sentiment. But I believe that the central policy makers are well aware of that and are trying to navigate through that situation. At the same time, we do have to invest, like in the United States, the big investment in infrastructure. I think the same thing needs to happen in India, both physical infrastructure, but also human infrastructure. We talked about healthcare. I think the lesson learned out of COVID-19, I believe, should be a focus and a investment in our health infrastructure, not only in India, but in Asia Pacific, as well as in across the globe.
Do you think the world, and especially India, is prepared for the third wave? I mean, all of us are hoping and praying that we do not see the third wave, but are we prepared?
We have to be prepared. We don't have a choice. And that is why Sanjivani is a good example of trying to prepare and make sure that we not only leverage best practices and fit for purpose techniques that are uniquely Indian, like the ASHA network that I'm quite impressed by. By the way, we are paying a stipend to the ASHA workers as well from Deloitte, as well as to the MBA students. But this is a uniquely Indian answer to addressing a big vexing problem. So we do have to be prepared. And I think we need to be prepared for any eventuality, a third or a fourth wave. This virus is a very tenacious enemy. And we all need to, not only in India, but across the globe, need to fight it with everything that we have. Unless we vanquish it or in the least suppress it, we cannot get back to the type of growth that we all want. And that is possible in a place like India. One other aspect. What India is going through right now and what other Asian countries are going through is not an Indian problem. This is a global problem. This is a global pandemic. Nobody is safe till we all are safe. Because the virus mutates, the virus has an ability to travel across the globe in a very efficient way. And as humanity, this is all of our task to try and address the issue that exists in India and elsewhere right now, as it existed in the West a few months back.
Now, Punit, in your initial remarks, you just mentioned something which you've been mentioning again, that this decade really belongs to India. So let me take the liberty of expanding on that thought slightly more. We can easily divide the Indian economy into four legs. One is export. Second is the government spending, third is consumption, and the fourth is private sector capex. So if this decade really belongs to the India, which part of the economy do you think will be the humming engine for this decade?
I think what will be a surprise, and it should not be, is the talent pool that exists in India. Deloitte's view and my view is that initially, if you take the technology growth and the wonderful technology companies that exist in India, it started on the basis of cost arbitrage. Today, it is a talent arbitrage play. The talent exists in India. The capability exists in India. The demographic dividend exists in India. And I think that is where the pleasant surprise lies. And I think it will surprise all of us.
Now, when we spoke last, Punit, you did mention that Deloitte India was committed to India and you were looking at making serious investments. Has the second wave altered that plan?
No, we've redoubled our effort. We're going to hire 75,000 people in India. It has certainly, the second wave and COVID has impacted us as it has impacted everybody. And so the ramp up may change a little bit, but our ultimate goal with around India stays. In fact, we have decided to redouble our effort in India. We have 50,000 absolutely wonderful professionals in India. We're doing everything in our power to protect and support them. And we will double our presence, in fact, more than double our presence in India over the next number of years. It's been a wonderful time speaking with you. Thank you. Please do take care of yourself and your families.
Well, Punit, really appreciate your time. Stay safe, and thank you for being part of India Reboot.